Good morning, students. Today I will teach you about lateral compartment of leg. I am Dr. Pratibha Shaki, Assistant Professor in Department of Anatomy, KJMU. Objectives of this lateral compartment of leg are: describe boundaries of the lateral compartment of leg, list and explain the muscles with their origin, insertion, nerve supply and actions, identify the nerve and blood supply of the compartment, correlate anatomical features with clinical condition and clinical anatomy. Then coming to the boundaries of the lateral compartment of leg. For understanding the boundaries, this is the diagram, which is the transverse section through the middle of the leg, showing the intermuscular and the transverse facial septa. Here, this is lateral compartment of the leg. This is lateral compartment of leg, and this lateral compartment of the leg is bounded anteriorly by the anterior intermuscular septum, posteriorly by the posterior intermuscular septum, laterally by the deep fascia of leg, and medially by the lateral surface of the fibula. Okay, so this is lateral compartment of leg. Now coming to the contents. Here two muscles are present, peroneus longus and peroneus brevis muscle. The nerve of this compartment is superficial peroneal nerve. Artery of this compartment are perforating branches of anterior tibial and peroneal arteries. And here small unnamed veins are present. They mostly drain into the short saphenous vein. Now coming to the retinaculum. Here the retinaculum is known as the peroneal retinaculum. Retinaculum, as you already know, that this is the modification of deep fascia. Here two peroneal retinaculums are present, superior peroneal retinaculum and inferior peroneal retinaculum. We can understand this retinaculum by this diagram. Here this is superior peroneal retinaculum, and this beneath to this superior deep this superior peroneal retinaculum, the tendon of the peroneus longus and tendon of the peroneus brevis passes, and after that, below to the superior peroneal retinaculum, there is the inferior peroneal retinaculum. There are two loops of the inferior peroneal retinaculum, superior loop and inferior loop. Through the superior loop of the inferior peroneal retinaculum, tendon of the peroneus brevis pass and gets inserted on its insertion point, and deep to the and through the inferior loop of the inferior peroneal retinaculum, tendon of the peroneus longus passes and gets inserted on its insertion point. Here, in this second diagram, you can see that that deep to the superior peroneal retinaculum, tendon of the peroneus longus and peroneus brevis, they are inside the common synovial sheath, and later on. Deep to the superior loop and inferior loop of the inferior peroneal retinaculum, actually they are inside their own synovial sheath. Okay, they are inside their own synovial sheath. Now coming to the peroneal muscles, there are two muscles present, peroneus longus and peroneus brevis, and as we already know that each and every muscle of present inside the body, we can understood all the muscle in the four headings: origin, insertion, nerve supply and action. So here we already and so here we also read these muscles in these headings. And here, for understanding the peroneus longus muscle and peroneus brevis muscle, first we understand the bony framework. This is fibula, and this fibula can be divided into the three parts. Upper end, this upper end is made up of the head, sternal process and neck, and this is the middle part, which is also known as the shaft, and at the lower end, this is the lower end of the fibula. This middle part, that is also known as the shaft, it has three surface: lateral surface, medial surface and posterior surface. This lateral surface can be again divided into the three parts: upper one third, middle one third and lower one third. This middle one third can be again divided into the two halves: anterior half and posterior half. After that, we have tarsal bones inside the foot, and here we have calcaneus. This is talus, and in front of the talus, this talus bone articulates with the navicular bone, which is both shape it. And in front, this calcaneus bone, it articulates with the cuboid bone. And in front of the navicular bone, there are the three cuneiform bones, and these cuneiform bones are known as the medial cuneiform bone, intermediate cuneiform bone, and lateral cuneiform bone. And in front of these tarsal bones, we have five metatarsal bones. The first metatarsal bone on the medial side, and the fifth metatarsal bone on the lateral side. Now, we read about the origin of the peroneus longus muscle. Peroneus longus muscle takes origin from the head of the fibula, and upper one third part of the lateral surface of the shaft of the fibula, and the posterior half of the middle one third of the lateral surface of the shaft of the fibula. Then after that, this the tendon of the peroneus longus muscle, it passes through the through the superior penile retinaculum, and then it passes through the inferior loop of the inferior peroneal retinaculum. After that, the tendon of the penis longus goes inside the groove of the cuboid bone that lies under surface of the cuboid bone, and then it gets inserted on the lateral surface of the base of the first metatarsal bone and adjacent medial cuneiform bone. This penis longus muscle is supplied by the superficial peroneal nerve, and it acts as an everter of the foot. It also helps in maintaining the lateral longitudinal arch and transverse arch of the foot. Now coming to the peroneus brevis muscle. Peroneus brevis muscle takes origin from the anterior half of the middle one third of lateral surface of the shaft of the fibula, and it also takes origin from the lower one third of the lateral surface of the shaft of the fibula. Then the tendon of the peroneus brevis, it passes through the superior peroneal retinaculum, and then it passes deep to the superior loop of the inferior peroneal retinaculum, and then it gets inserted on the lateral surface of the base of the fifth metatarsal. Okay, now coming to the superficial peroneal nerve, it is a smaller terminal branch of the common peroneal nerve given at the neck of the fibula. It arises in the substance of the peroneus longus muscle lateral to the neck of the fibula, and this neck of the fibula is actually it is a very important landmark, because when there will be injury or there will be a fracture at the neck of the fibula, then it will lead to the injury of the superficial peroneal nerve also. Okay, and that is very important line for the NEET PG. And here the after that, it's the superficial peroneal nerve descends in the lateral compartment of the leg deep to the peroneus longus and lies between the peroneus longus and peroneus brevis muscles. And lastly, between the peroneus brevis and extensor digitum longus, it pierces the deep fascia at the junction of the middle and the lower third of the leg, and soon divides into the medial and lateral terminal branches, then descends to the dorsum of the foot. Branches of the superficial peroneal nerves are the muscular and the cutaneous. Muscular nerves supply the both peroneus longus and peroneus brevis muscle. Cutaneous supplies the skin of the lower one third of the lateral side of the leg and most of the dorsum of the foot, except for the territory supplied by the saphenous, sural, deep peroneal, and plantar. As we already know that the nail beds are supplied by the medial plantar for the medial 3.5, by the lateral plantar for lateral 1.5 toes. Actually, the nerve supply of the dorsum of the foot will be covered on the in the dorsum of the foot lecture. And adjacent sides to the big and second toes are supplied by the deep peroneal nerve. The medial border of the foot is supplied by the saphenous and lateral border by the sural nerve. Now, clinical anatomy, whenever there will be the injury of the superficial peroneal nerve, it will lead to the loss of the eversion of the foot due to the paralysis of peroneus longus and peroneus brevis muscle, because they are the everters of the foot. Sensory loss on the lateral aspect of the leg, and also on the dorsum of the foot, except for the territory supplied by the saphenous, sural, deep peroneal, and plantar nerve. This is the link of the Google form. When you will go through this link, there will be an MCQ test form, and here you will answer these MCQs, and these answers will be recorded in the Google form. This is the QR code. And by scanning this QR code, you can give feedback. This is, and these are the references of the this lecture. Okay, now thank you students. And if you have any query, then you can ask me in the next lecture. Okay, thank you.